My name is Jeffrey Murray, orthopedic surgeon in the Chicago area. I did my residency at Duke University for 6 years, and then a 1-year sports medicine fellowship at the University of Tennessee in Knoxville. I practiced for a short time in North Carolina after that, and I've been in the Chicago area since 2011, focusing primarily on the sports medicine practice. I played football in high school and got a number of offers to play in college, and so I've always been interested in sports. And then throughout my residency at Duke, I was involved with a lot of the athletic teams, and that fostered interest in soft tissue trauma and working with the athletes at all skill levels, which gave me the opportunity to spend my year at Tennessee, which was a very good year, the year we won the national championship. And since then, I've been able to do mostly sports medicine practice. We do all general orthopedics with a primary focus on sports medicine. Doing a sports medicine practice, we're involved with the care of 2 local high schools. We work closely with the athletes from Elk Grove High School as well as the athletes from Lake Park High School, which entails direct contact, including being available on Friday evenings at the sidelines of the football game to attend to their injury right when they happen. I think it's important for us in general to give back and volunteer with the community and offer our services. And plus, it's very helpful to be there at the initial assessment because many of these injuries are difficult to assess more than 15 or 20 minutes after they occur with the swelling and the pain. So it's very nice to be there initially. I really like getting patients back to their pre-injury level of function so they can see the successes and return to really the activity that brought them into the office in the first place. It's very reassuring and satisfying to hear their return. My approach to patient care is unique. I like to maximize non-surgical treatment prior to consideration of any surgical intervention for the multitude of injury varieties that we see. Also like to stay on top of these injuries and treatment approaches so that we can maximize their outcomes. For patients who are nervous about surgery recovery, it's certainly understandable to be nervous about undergoing a surgical procedure, but you have to realize that oftentimes these injuries have very salvageable treatments that do involve surgery and allow them to return to their pre-injury level of function and their pre-injury level of activity. Most procedures from a surgical standpoint are done as an outpatient where patients will come in and go home the same day. And initially, physical therapy will start within a few days, typically out from the procedure, so the recovery process starts very quickly after the surgery. So surgery is usually not something to be entered into lightly, but it certainly is something that has a very positive outcome and effect on returning patients and athletes to their pre-injury level of function.